Right, so if you have read and understood, considering the history taking station, kindly begin.
Hello, I'm Dr. Karma, one of the exam candidate. Today I've been asked to ask you a few questions regarding your condition. Are you okay with this?
Yes, I'm fine. Thank you.
Before we proceed, may I confirm your name and age, please?
Yeah, my name is Andrew. I'm 64.
Hello, Andrew. Nice to meet you. So, what brings you here today, Andrew?
Yeah, thank you, doctor. I think it started 2 days ago. I started having tummy was paining me, and I couldn't pass anything down since 2 days now.
Okay, I'm so sorry to hear that. So when did you notice it first?
Well, about my tummy, well, I think about 6 months ago, I noticed blood, been passing blood here and there from the stool. But I'm okay with that. Just some little blood, sometimes with the stool, sometimes just alone. But no pain at all. Just 2 days ago, I had this serious pain and I can't pass anything.
Okay,
That's why I
so
came to the
where exactly you're having the pain?
Yeah, it's
Tummy?
just my tummy everywhere. Not really.
All over.
Yeah, just dull pain
Okay.
everywhere.
And the pain was sudden in onset?
Yeah, kind of.
Okay. And did the pain go anywhere else?
No, it's just discomfort
What
in my tummy.
what is the character of the pain? Is it cramping? Is it dull aching, or is it stabbing?
No, it just comes and sometimes it leaves me. I'm fine, and before I know it, sometimes it comes again. Just comes and
Anything that increases or decreases the pain?
nothing that I've noticed so far. It's just 2 days now.
If you if you have to rate the pain from 1 to 10, and 10 being the most severe pain, how would you rate your pain?
I'll say 7. 7 or 10. Yeah.
7. Okay, you're having quite a severe pain. Do I offer you some painkiller,
No, I'm
or
fine.
is it
Right now,
okay?
I'm not having the pain. Like I said, it comes and goes. But when it comes, it's really
Oh,
about 7. Yeah.
oh, okay. So regarding your bleeding, is it like continuous, or it comes and goes?
Yeah, it comes and goes. It's not continuous. Sometimes with
And
mixed with my
and
stool.
okay, and it is mixed with the stool.
Yes.
And uh, anything that stops or anything that increases this bleeding?
I've not noticed anything. I just noticed when I go to the toilet. I just notice fresh blood.
Okay, and what is fresh blood? And what is
Yeah.
the color and amount
It's red. It's red. It's red.
and amount?
Yeah, it's not really much, really. That's why I haven't bothered about it, as I'm just coming because of the pain.
Okay, and did you notice any disturbance in your bowel regarding your bowel habits?
Yeah, sometimes. Of course, now you can see that I'm not passing anything from my tummy. I usually go to toilet often, like 3 times in a day. Now I've not gone to the toilet for the past 2 days.
Okay, and did you notice any loss of appetite or unintentional weight loss?
Yes, I haven't been eating well for the past 6 months. I think my appetite has been bad. Yeah. I mean, I used to eat like 3, 4 times in a day. Now I barely, eat twice in a day. And I think I've lost
Okay,
I've lost some pounds as well.
okay, I can understand how difficult it is for you. Did you notice any slime or discharge or any tummy pain when you open your bowel?
Yeah, I do have tummy pain when I open my bowel.
Okay. Have you had any fever or mouth ulcers, painful red eye?
No, I don't have fever.
No. Any joint pain or back pain or any skin problems? Did you notice?
No, I don't have any skin problem.
Do you think this? Did you notice any bleeding? I mean, bleeding from any other orifices?
No, no.
Do you have pain while passing stool?
Just the pain just started 2 months ago, but it's not the pain. Like I said, is not really down there. It's in my tummy. I don't have pain.
Okay. And did you note? Okay. And did you notice any itching around your back passage or any swelling in your back passage?
No, I don't have swelling.
Have you been abroad recently?
No, I haven't been abroad for the past 10 years.
And have you been? Have you noticed any urge to pass stool in spite of, passing little amount?
Yes, I go to the toilet to pass to, but nothing comes out, just blood.
Did you notice any? Did you have any long-standing history of constipation?
No, just 2 days. I've never experienced it before.
Okay. Do you have any other medical condition or anything that for which you have seen your GP?
Yeah, I'm fine. I'm taking some drugs for my hypertension, and that's all.
Any history of surgery in the past?
No.
Present your history now, please.
Okay, I've taken history from this 64 years old male.
Yes.
If time would have permitted, I would like to ask about I would like to complete the family history, personal history, the eyes, and the systemic review.
Yes, and the drug
64 years old male who came with complaint of abdominal pain, which is all over the abdomen with no radiation. It's cramping in nature, so with passing of fresh blood in his stool since 6 months, and he also has history of weight. He also has history of anorexia and weight loss of 10 pounds in the recent weeks.
So what are your?
He has no history of.
So what are your differential diagnoses?
He has no history of other. From the history, my first provisional diagnosis will be cancer colon.
Yes.
And I would also consider inflammatory bowel disease, any gastroenteritis, other causes like hemorrhoids, and also diverticular diseases.
Okay, considering the differential diagnosis of this patient, what would be the most important investigation that you would want to carry out?
Considering this, the most important investigation would be a colonoscopy, and with plus minus biopsy.
Yes.
And I would also consider rigid sigmoidoscopy if it is available.
Yes.
Then I will do some blood investigations, full blood count to rule out anemia, leukocytosis, do urine electrolytes and liver function test, do an ECG and arterial blood gas analysis. I'll also do an upper GI endoscopy to rule out upper GI pathology. Then also want to do mesenteric angiography and abdominal X-ray, and also a stool culture.
Good. Yes. Good, thank you. So, Dr. Abdulrazak, could you give feedback first?
Thank you, Dr. Kama. I think he covered almost everything. All the questions he asked were tailored towards him trying to rule out the differentials. Really, he asked about the anorexia and weight loss, which will support the malignancy. He also asked about swelling around the anus.
Yeah.
Which also suggests maybe some form of hemorrhoid or.
So I think, yes. Anything that he missed, he can learn from it.
Yeah, well, he has said that he's going to try to cover. It would have, if time permitted, he would have tried to mention them. Like asking for family history of a malignancy of cancer is very important if you're thinking of a colonic CA. Yeah. So.
Yeah, he covered most of the things of the patient in complaint. But did you ask the amount of blood?
Yes, ma'am. I
think he asked. He asked.
Yeah, I'm sorry, I missed.
Yeah, and I said it wasn't much. That's why I've not come to the hospital. I'm not disturbed about.
Okay, because I remember he asked everything about the pain, but then I wasn't sure if he asked you about the amount of blood. Otherwise, like he at the end he covered because the things that he missed, he said if time would have allowed me, I would have covered.
Yeah.
So
I just think that in the investigation, it might not be appropriate to do an upper GI endoscopy because the blood is fresh.
not upper, it was
Blood is-
colonoscopy.
yeah.
He said
Okay. Later he said upper and upper GI. So,
no, that was sigmoidoscopy. He said
oh, okay. All
he
right.
did
So just
sigmoidoscopy.
basically lower GI.
Yeah, because
I
that
said
was his friend.
upper GI to rule out upper GI cause, ma'am.
Yeah, but you know,
Upper GI
upper GI
cause,
cause,
yes,
upper GI cause,
yes,
I don't
to
know, they're not
exclude.
in your differential.
They were
And
not
if you have upper GI cause, you probably have a dark stool, not fresh. So that's what I'm
It
thinking.
will be dark, Melina. Yeah.
Yeah,
So
not fresh.
this last sentence, see, you noticed. I didn't even notice that. Yes, omit saying it. Don't say that because the rest I was noticing. You were telling me to write, but just yeah, can give confusion. So don't use that word. Good. Thank you. Good. Started your timer, and here is your question.